It's estimated that there are hundreds of people living with albinism in rural areas of Malawi who have skin cancer but cannot access diagnosis or treatment because hospitals lack the capacity. The climate crisis that has been exacerbated by huge deforestation, the country has seen longer hot and dry seasons. The past 2 decades, average temperatures have risen regularly, with almost 140,000 people in the country living with albinism, and 85% of them in poor rural areas. The heating climate has a direct impact on their skin and health. The Association of Persons with Albinism in Malawi says there is a lack of access to medication, sunscreen, and early-stage cancer screening because of the absence of any dermatology or ophthalmological services in rural facilities. Now, joining me live from the Malawian capital, Lilongwe, to discuss this is BONFACE MASSAH. He is the Executive Director of Standing VOIVE in Malawi. A warm welcome to you, BONFACE, and thanks for joining us below the skyline.
Thank you. Welcome.
Now, BONFACE, how widespread are cases of cancer among people living with albinism in Malawi?
Yeah, I think overall it's a big problem. As Standing Voice, we are one of the organizations that is working closely implementing a comprehensive skin cancer program in Malawi. And we have seen across Malawi where patients have been presented with severe cancer problems, lack of knowledge amongst persons with albinism themselves on sun protection, early identification of cancer, but also early treatment of cancer has also remained a big challenge in terms of interventions around skin cancer. But important is the lack of knowledge among even clinical officers to properly support cases that have already been identified with cancer, as well as the knowledge for persons with albinism ourselves in terms of behavior change and sun protection habits to protect from this skin cancer problem.
Now, BONFACE, what are the primary causes of these of the cancer infections amongst people living with albinism?
So as we are aware in Africa, in sub-Saharan Africa, particular countries like Malawi, it's very hot. So due to the lack of melanin on the skin of persons with albinism, majority of us are very prone and sensitive to sun damage. So issues of poverty also contribute. Majority are still living in poor households and they rely much on farming. They spend a lot of work in the field or doing piecework. As a result, they have long hours of exposure to the sun. And lack of protective clothing, lack of knowledge, all these are also big elements that are contributing to skin damage amongst persons with albinism. We are aware as an organization that there is also limited access to sunscreen. It has improved over the last 4 years, but that has been also the greatest problem for majority of persons with albinism to access regularly sunscreen, which is a product that we use every day for the rest of our life as a protective mechanism for our skin.
Now, beyond access to sunscreens, what help, or rather, how can the government in Malawi and the general public and, non-governmental organizations help people living with albinism? What are the biggest challenges and how can they step in, especially people living in the rural areas? How can they step in to mitigate this harmful effects of the exposure to the sun?
Yes, so one thing that we are doing as Standing Voice in collaboration with government is that we are running skin cancer mobile clinics. So these are clinics that are running every 6 months and 3 months, going out in the rural areas, mobilizing patients, people with albinism, doing screening, identifying lesions, providing minor surgeries and major surgeries. But we are also trying to intensify issues of palliative care and management for patients that have been identified with skin cancer. So going back to strengthening the system, training health workers so that they are aware on the immediate need to support persons with albinism, but also we're working closely with community members and persons with albinism themselves to be able to present themselves early when they have identified any lesions on their skin to the hospitals.
Thank you very much, BONFACE MASSAH, Executive Director, Standing Voice Malawi, for your time and contribution.
Thank you.